హాయ్ హలో వ్యూవర్స్ వెల్కమ్ టు సోషల్ పోస్ట్ నేను మీ శ్వేత సో ప్రస్తుతం మనతో పాటు స్టూడియోలో ఉన్నారు కో ఫౌండర్ అండ్ డైరెక్టర్ ఆఫ్ ఐసామెడ్ తేజిందర్ సింగ్ నమస్తే సార్
Namaste.
హౌ ఆర్ యూ
I am good. I am good.
కమింగ్ టు ఐసామెడ్ వాట్ ఈస్ దిస్ ఐసామెడ్
IISAMED is International Institute of Surgical and Aesthetic Medicine.
ఓకే వెన్ ఇట్ గాట్ స్టార్టెడ్
It started in 2023.
ఓకే సో వాట్ ఈస్ ద మెయిన్ మోటో ఆర్ వాట్ ఈస్ ద ఇన్స్పిరేషన్ టు స్టార్ట్ దిస్ సార్
Okay, well, I am basically a business consultant. I've been consulting the companies to grow, and I've been consulting the education institutes in India also from past maybe more than 15 years. And over the last few years, I believe that, and I feel and observe that there is a good amount of education gap in the studies,
ఓకే
and I wanted to fill the gap.
ఓకే
That's how I get into the situation there where I build a company, build an institute where we should fill the gap over there. By the end of the day, if the student does not feel confident, the trainings they are not able to start their practice, we are here for them actually. We are
ఓకే
making sure that by the end of our training, they should feel confident. They should able to start their practice. They should help the society also.
ఎస్ సో కమింగ్ టు దిస్ ఐసామెడ్ మిషన్ యాజ్ యూ టుక్ ఎ పార్ట్ ఆఫ్ ద మిషన్ ఆఫ్ దిస్ సో హౌ యూ ఆర్ డీలింగ్ విత్ ద aesthetic and or cosmetic clinic doctors or education students.
So basically, mission of the IISAMED is to create good esthetician first.
Mm-hmm.
And they should be able to well verse in helping the society, making the doctors patient oriented doctors.
Okay. As we are seeing in the market, India is getting most popularity in this medical aesthetic surgeries and treatments and all. So, what are the three trending treatments going now?
Non-surgical augmentation, facial contouring, and aesthetic rhinoplasty.
Coming to the market, if you are looking from the last decade of this, perception of the people who are taking these treatments and surgeries and all, it changed a lot. What's in your point of view? How it changed?
Yes, it's all because of the social media awareness, and nowadays the people are preferring aestheticians over beauticians,
Okay.
right? And they are very much okay go for the invasive procedure or minimally invasive procedures.
Mm-hmm.
So they are very much comfortable with these days to enhance their facial and things.
Okay. So coming to IISAMED's training program, how unique and how different it is when compared to the other aesthetic clinics in our country?
So IISAMED is basically stand with the expert faculties, cutting edge technology what we have on the board, the good amount of hands-on training what we are giving.
Mm-hmm.
That basically give the confidence to the doctors. They should be able to set up their clinic. Even we are helping them also even after completing their courses, how to set up your clinic. Even if they get stuck somewhere while consulting the patients, what is the line of treatment for them? We
Okay.
are there for you. That is there for life actually.
Okay. So where is this IISAMED's trainings are going on?
This happens across India and abroad. We are in Delhi, Mumbai, Chennai, Hyderabad,
Mm-hmm.
Pune, Chandigarh.
Okay.
Even internationally, we do trainings in Cambodia, Sri Lanka, Vietnam, and so on. So yes, people are collaborating with us, and we do that in such a way.
Okay. The who are watching this video, how they can contact you?
They can contact through our WhatsApp. They can go through our website, and we'll just push in our numbers also, and they can connect to us. The counseling team will be there. They
Mm-hmm.
will counsel them as per their basic qualification, what course you can go for, and then we can go through the online classes and so on. We need to prepare you first before going for the hands-on training. So
Okay.
yes, there is a learning before the hands-on training to make you well versed with the theoretical things first. A bit of knowledge will be given to you before the hands-on training. So when you come down for hands-on training, you basic things will be clear first, and then you would be able to go further advance in terms of theoretically as well as hands-on training. So it's a 360 kind of a thing. Though before you finish up a training with us, you feel confident. You feel that I have covered everything.
Yes. Yes. So is there any particular qualification to get joined in this training sessions?
We have the different courses for different aspect of trainings. You need to be a general physician first or the medical doctor to go for such kind of a trainings. We have such training for non-medical also, but they are limited with their procedures. They couldn't help the esthetician to be a therapist at their clinic.
Mm-hmm.
We can't say that, okay, being a non-medical, you perform all the procedures. No, you need a mentor on top of you, or at the same time, estheticians also need therapists at their clinics.
Mm-hmm.
So we are preparing their workforce for the estheticians to help them.
Okay. So, coming to a general physician, they can become the aesthetic cosmetic doctor also.
Do provide the training for them. There are different courses available. If you're not into aesthetics as of now, you should start with a basic course with us, maybe a fellowship course with us. We'll give you a 360 kind of training around there, where you cover all the topics, the basics one. Then you
Mm-hmm.
can plan your procedures or maybe the practice in such a way that you want to go for more surgically or go for more facial injectables and so on. So we have different courses on top of that, and we'll give you the a line of career around there, that how you proceed further in your life.
Okay. So you are giving any job placements or any assistance?
Yes, we do. We have a lot of agencies coming to us who do have these centers across India. Being aesthetics into commercial business, they are, so they need a good amount of workforce, and we do help them by providing their CV. We are being a bridge between the doctors who are just completed training with us and they wanted to go further for job. Either they are
Mm-hmm.
setting their own clinic, so we are there for them. Actually, no worries on
Okay.
that note.
So coming these days, we are seeing many fake doctors, not like fake doctors, half knowledge doctors also. So people are going with many myths. Are they genuine or fake? Are the treatments are real or fake? We don't know. So what is the biggest myth you just want to burst it out?
We are at the one of the institutes in India. Before you coming to us, we're gonna check your degree first, ask about your basic qualification first.
Mm-hmm.
If you are not a doctor or you don't have the degree, we are not going to offer the course at all, right? And at the same time, when we are offering the course, that is based on your basic qualification. If you don't have the basic degree with you, or any institute in India do not have any right to give any kind of a licensing to any doctor to start practicing the aesthetics.
Okay.
They should have the basic degree first. For example, an MBBS doctor can perform these procedures. We are doing
Okay.
superficially,
Mm-hmm.
right? They can perform these procedures, so they don't need any further degree on top of
Mm.
that. And we
Okay.
are just basing adding more feather in their practice. We are not giving them the license to practice.
Mm-hmm.
The license has to be there with you first.
Okay.
We are just adding more feather in your practice.
They are giving the training only for the licensed doctors,
Absolutely,
licensed
yes.
general physicians or
Right,
anyone.
right.
But
If
they
you
should be
don't,
licensed.
yes, if you don't
Okay.
have the degree, we are not going to offer the course for sure.
Okay. So this is the rule mandatory.
Rest, this is the mandatory rule. You have to come to us whenever you're joining the course. Yes, we can check your degrees, but whenever you come to us, you have to copy of your degree. You will be signing the documents. We will be
Mm-hmm.
cross-checking attire and also. So we are making sure that okay, whatever the education we are giving it, you are going to help the society, not ruining the industry for sure.
Super. So as the demand is getting more day by day in this aesthetic and cosmetic surgeries, treatments and all, so is this getting impact on the people like psychologically?
Yes, a lot. I mean, imagine a scenario that I, being a person going to office every day, I might have a deep acne scar on my face. I might lose confidence, right? I am a person, we are living in India where I am a 20-year-old girl, where I have a acne scar and so on. I'm not able to get married. I see these kind of cases a lot where we are teaching our doctors how to treat or how to do the procedure on their face, so they feel confident, right? So that kind of a thing we do teach, and making sure that we are helping the society in every possible way.
Okay. Coming to IISAMED training programs and all, how ensure you will give for the safety protocols?
See, whenever we do the hands-on training, we're going to create the actual setup of your clinic in our
Mm-hmm.
premises, and wherever we conduct the training, we believe that okay, the area to be sanitized first. Any patient coming to us, we do the proper consultation, we get the consent form. Whenever you see in any of our training, you will see that okay, the patient is wearing proper apron, the doctor is performing with their proper gloves and so on. Whatever the indications being given as per the by the patient, we are performing the procedure according to that only. And top of that, the mentor would be there to
Okay.
ensure that every procedure is going with us is 100% damn correct.
Okay. So when the patient is interested to take some treatment and coming to the medical reasons, do you have any cases that you refused the treatments?
Yes, many time a lot. I
Okay.
mean, if I believe that okay, this is what patient oriented is comes in picture.
Mm-hmm.
If a patient coming to me in one of my training, of course, for any procedures what we are performing, there is to be a some time gap to be maintained between two sessions.
Okay.
If example a patient coming to me, they might have took some session maybe from some other doctor. They are coming to me liking my things, and we get to know that okay, you have taken some sort of things,
Hmm.
not having maintained the proper gap. I'll refuse. So that thing has to be there. For
Okay.
example, a patient coming to us, they wanted a hair transplant. I don't give them if they don't need it. If you ask me for any specific procedure, until unless you don't need, I don't give it. In
Mm-hmm.
my trainings, this is
Hmm.
what the criteria we are building with our doctors also. This is how the doctors will be patient oriented.
Okay.
We have to serve the community as per their need, not as per their demand.
Exactly. So, as we are in this AI generation, so how AI is helping in this, or how robotics are helping in this modern aesthetic or medical surgery treatments?
Yeah, more of things like that. Okay, in our cases, we have facial scanners and so on. Where you come down to us, we have the facial scanner where
Mm-hmm.
you scan your face, you see the entire AI based report, where exactly deep pores are there, open pores are there, how the skin is oily, what is the age of the skin. So patient also get to know their details of the skin also, and accordingly, the aesthetics or aestheticians can plan their procedures also, line of treatment also.
Okay, so can you brief us like the advanced tools or techniques which you are using in ISAMED that the other cosmetic clinics are not aware of that?
One of the technique you can say in my courses have been introduced that nobody's covering most of the time in across India and abroad. One of the topic that we are covering is called scar revision or subcision.
Okay.
That basically a person who having a deep acne scar or atrophic scar, how to subsize it, and before the subcision of those scars, we perform basic procedures like microdermabrasion, hydrofacial, needling, and so on. And after that, we subsize it. On top of that, we give advanced lasers called CO2 fractional laser that will resurface the entire skin, and the patient will be feel fantastic after the procedures. So that
Okay.
is one of the procedure that we are teaching in India is called scar revision subcision, which nobody covers in such kind of trainings.
Okay. So what you are doing like to get aware of ISAMED to the people? So what kind of programs you are taking part in this Hyderabad?
We are taking a lot of trainings in Hyderabad. We keep coming every quarter and so on for past 2 years. We do conduct training for doctors where we do have a course of fellowship course in aesthetic medicine. This is over 8 days of hands-on training where we cover all the basic to advanced aspects and teach them well.
So ISAMED is growing day by day. So the next 5 years, how you are imagining where the ISAMED will be nationally or globally?
See, after 5 years, I don't want to boast about myself that I have trained so many doctors or stuff like that. But I wanted to see after 5 years the doctors we have trained, either they are practicing, either they are on job, and that they should be more patient oriented and helping society.
Mm-hmm.
Number is not a game for me as an director for the ISAMED. For me, building a good team, good aestheticians in the society is my mission as an ISAMED. So basically, the concept of the mission of the ISAMED is to provide good aestheticians in the industry. They
Okay.
should serve the society first. They should be patient oriented first.
Yes. So are you planning for any collaborations with the universities for medical colleges or global certifications?
Yes, why not? If anything, any collaboration which further help my students who are coming to us for learning,
Hmm.
we are very much open. The only thing which we keep things with ourselves that we wanted to have the entire control on our studies, the level of education what we have created from past 2 years, we wanted to maintain and keep getting high in coming days. I never will going to compromise on that level, but yes, if any collaboration is there, any medical board is there, we are also forming something down there. And if any institute wanted to collaborate with us, they can. But yes, they can work with us operationally, marketing, sales, but not on education, because we are not going to give any kind of a control on the education level.
Super. So one final question, sir. As per your, so far you are in this field and you are training many students. So what is the most fulfilling moment you had in this?
We have many. I have many cases like that where a patient coming to me and they are losing their confidence because of some issue with their face or enhancement and so on. After the procedure, when I see the smile on their face, the confidence in them, that really cherish me and making me feel that okay, we are on right track.
Oh, super. So what is the advice you just want to give for the upcoming aesthetic doctors?
So, yes, if you wanted to come into aesthetics, if you are a medical professional and wanted to build your career in such a way, it's a very booming market. And if you ask me honestly, in India, kind of population we have, every single esthetician have more than 1 million patients with you, right? So you are on right track. If you want to be a good aesthetics, come to us.
Mm-hmm.
We will make sure that okay, by the end of the day or by the end of the training, you are confident enough to start your practice, and as I mentioned earlier, help the society first.
Okay. So thank you so much, sir, for this
Thank you
information.
so much for
Thank
having
you.
me here.
Thank you.
Thank you.